Policymakers, doctors and global health experts have converged in New Delhi for WION's Health Pulse Summit. He is an expert for the first session, which focused on what makes India the pharmacy of the world and what are the challenges going ahead. Take a look.
We now have to begin the next part of the journey, consolidating what we have already accomplished, ensuring that we continue to serve the needs of the world while addressing India's prioritized needs, and thereby actually continue to be the global pharmacy with the best of intent and best of performance as well.
Dr. Alonso, I have to get you in here because, a lot of your work extensively talks about this intersection between medical standards and global innovation, which is increasingly important in today's context. And touching upon what Dr. Reddy just mentioned as well, India's role when it comes to also ensuring that public healthcare access is bridged to the extent that it has already done. Your comments first on how you see India's position on that front.
So I see India has a lot of advantages in comparison with other countries because of its expertise and its leadership and also its potential to scale. And I do think that we have to look back to the pandemic. I know everyone talks about the pandemic, but I think we have to reflect because I think the world became aware that we have dependency on the manufacturing centers. And I feel very proud and very honored to be living in India and be part of this ecosystem because people think that people in Western countries tend to think, oh, Europeans are coming to India, or Westerns are coming to India to solve India's problem. And I always say, no, I'm coming to India to learn and to see what I can take to Western countries from India.
But coming back to what we were discussing at the outset, the challenges in bridging the gap, Dr. Singh, when it comes to healthcare access, India's push on that front has been multi-pronged through its initiatives, through its various incentive-based schemes as well. If you can just set the stage for some of us in the audience as well who might not be very well apprised with what India has really done on that front.
Right. So the challenge of healthcare access is not unique to India. Exactly. Let me be very honest and upfront about this. 50% of the world does not have access to healthcare, yes. Right? The second part is that we have this notion primarily because our health system, and Sir is here far better equipped to this, from the formation of our Boer Committee in 1942 onwards, the principles of providing care at the primary level, which was emphasized, re-emphasized, unfortunately did not happen, right? And it fell off the wayside. While other countries, and well, they are called as the high economic countries, they focused on primary care. And the tertiary and the quaternary care followed. We simultaneously embarked upon trying to address the primary health care and pushed it down in our federated system to the states. Right? So the states were responsible to take care of the primary health care, and the central piece would make the education, the quaternary, the tertiary, etc., etc. So this kind of duality, that is, trying to make sure that the primary works at the same time the tertiary works, kind of brought in that divide of progress on both points.